We got a question for you, Governor, from a lot of the eastern Kentucky counties. As you know, your administration has put a lot of money into combating illegal drugs, and particularly opioids in eastern Kentucky. Yet that still remains the #1 challenge, decimating a lot of our families and impacting a lot of our counties and physical services in eastern Kentucky. What would you like to see done or done differently in the next 4 years to help address this problem?
The one thing you're going to see in the next 3 years, actually, is that we just won a grant for $87 million from the National Institute of Health. Every state competed for this. Only 4 states were chosen. The other states, Massachusetts, New York, and Ohio, are all much bigger than us, and yet we were granted the largest amount of money in the history of Kentucky for such a grant, or in the largest in the country by the NIH. 100% of that $87 million in the next 3 years is going to be spent in our 17 most hard-hit communities where we have the greatest number of overdose deaths. And what we're going to do is we're going to spend it on what I described, wraparound services, bringing every facet of the community together to how do we intercede, how do we get alongside these people before they fall into this funnel of addiction and end up losing their life or their family. How do we get involved in this early by wrapping around? And this is what we're going to do. So these things, together with the tens of millions of dollars that I've already budgeted in my previous 2 budgets, and the commitment that we have within our DCBS, our CHFS, which is our Cabinet for Family Health and Family Services, and then our Department for Community-Based Services, all of our social workers. Where can we touch people and have the most effect? And where can we as a state come alongside and encourage local, private, nonprofits, and for-profits to come alongside and help these communities? That's the only way we're going to do it. It's people to people. Government programs aren't going to fix the problem. The root cause of addiction is people feel hopeless. And when people lose their jobs and they lose the prospects of jobs and they lose economic opportunity, they fall into despair, they feel hopeless. People who become hopeless end up making inhumane decisions. That loss of humanity that they feel, they make inhumane decisions about themselves, about their own families, about their communities. And it's this downward spiral. So how do we reverse that? We bring jobs and opportunities and dignity and hope back to people. And that's my commitment. And I'm telling you, you watch the change. Last year in America, the number of opioid-related deaths and overdose deaths declined for the first time in 31 years by 5%. But in Kentucky, we saw a 15% decline. So we are 3 times the rate of this country are declining. And it's because of this focus that we're making. But we're just getting started. I intend to wipe this scourge off. Will we ever eliminate it entirely? Of course not. I wish we had a magic wand. But I'm telling you, you watch the progress. We're leading the nation on this, and we will continue to in the years ahead.
Thank you, Governor. Appreciate you.